Hi, this is Dr. Emily Mills of the University of Southern California, and I'm speaking to you about my JBJS article, Patients with Hip Osteoarthritis Have a Higher Rate of Spinal Reoperation Following Lumbar Spinal Fusion. There's been a lot of literature published in the past couple years that has looked at the effects of stiff lumbar spines, either due to lumbar fusion or lumbar degenerative disease, on outcomes and dislocation rates following total hip arthroplasty. So it is now well accepted that stiff spines cause increased dislocation risk following total hip replacement. However, on the contrary, there are very few studies that look at the effect of stiff hips on outcomes following lumbar spinal fusion. Both the hip and spine contribute to motion through the pelvis when going from a standing to a sitting position, with the hips flexing, the pelvis retroverting, and the lumbar spine flexing to maintain an upright sagittal posture. It therefore follows that if there's decreased motion through the hips, that there will be increased stress through the lumbar spine. So that was the rationale and motivation behind this study. We wanted to see if patients with severe hip osteoarthritis had increased reoperation rates following lumbar spinal fusion. So we used the 5% Medicare Part B claims database to answer this question, and we did find that patients with hip osteoarthritis had increased rates of reoperation at 3 and 5 years postoperatively. Common reasons for this included adjacent segment disease and pseudoarthrosis. So we hypothesized that patients with hip osteoarthritis were more likely to require compensatory flexion and extension through the spine. And because of this increase in motion and the increased stress placed on the lumbar fusion construct, there may be an increased risk of pseudoarthrosis or mechanical complications, as well as adjacent segment disease. We are hoping to investigate this hypothesis further with a prospective database that we are currently working on collecting.